The answer to this MCQ is 4 to 7 millimeter. So, what is Keros classification? Keros classification is a radiological system to assess the depth of the olfactory fossa. It also helps us to assess the ethmoidal skull base. So, you know that ethmoid bone is open superiorly. The superior part of the ethmoid bone is closed by the orbital plate of the frontal bone, and the ethmoid cells indent on the orbital plate of the frontal bone, and it's known as fovea ethmoidalis. The fovea ethmoidalis separates the ethmoid from the anterior skull base, and medially the cribriform plate of the ethmoid bone, that is a horizontal plate, separates the olfactory fossa of the anterior cranial fossa from the olfactory cleft in the nose. Imagine that this is the cribriform plate, this is the lateral lamella of the cribriform plate, and this is the fovea ethmoidalis, and this is the olfactory fossa. So the lateral lamella of the cribriform plate forms the lateral boundary of the olfactory fossa, and the medial boundary is formed by the crista galli. You have the crista galli. So this depth forms the depth of the anterior skull base. So the depth is based on the height of the lateral lamella of the cribriform plate. So if the height is 0 to 3 mm, it is type 1. If the height is 4 to 7 mm, it is type 2. And if the height is more than 7 mm, that is 8 to 16 mm, it is type 3.
So what is Keros classification type 4? There is asymmetry in the depth of the olfactory fossa between the right and the left side in the same person.
So what is the clinical significance is that when the depth is more, the cribriform plate will be lower, and there is more chance to injury to the cribriform plate by trauma or any tumor erosion or any idiopathic intracranial hypertension that can cause spontaneous CS of rhinorrhea, and also in endoscopic sinus surgeries. So when it is lower, there's more chance of injury when you do an endoscopic sinus surgery and an orbital decompression, etc. So before you take up a case for PEF, you in the CT, you have to identify the level of the anterior skull base using the Keros classification to be sure that you are safe. If you injure the cribriform plate, there can be CS of rhinorrhea. Also, there can be chance of injury to the anterior ethmoidal artery. There are 3 types of anterior ethmoidal artery. So type A is anterior ethmoidal artery is running in the skull base. Type B is anterior ethmoidal artery in the skull base, but it shows a small indentation downwards. Type C is anterior ethmoidal artery will be having a free course in the ethmoid, and it is connected to the skull base via thin bone masonry. So injury to anterior ethmoidal artery is a serious complication. If the lateral part is injured, it can like contract into the orbit. So there will be orbital hematoma, and there can be compression of the optic nerve and cause blindness. So Keros classification: anterior skull base, type 1, 0 to 3, type 2, 4 to 7, type 3, 8 to 16, and it helps to assess the depth of the anterior skull base.